Alright, so this is going to be my postpartum assessment. This is my postpartum mother. So I would first want to go in, I would want to introduce myself. Hi, my name's Kylie. I'm going to be your student nurse today. Is it okay if I go ahead and perform this assessment? So next I would want to perform hand hygiene and don clean gloves, and of course verify the patient's identity with their name and date of birth that matches their band. So after I've done all of that, I would want to first start with the breast. I'm not going to actually palpate or examine the breast, but I will ask if they've had any redness, any soreness, do they have any hard spots, do they have any drainage, discomfort, or cracking of their nipples. And I would also want to palpate the breast to see if I feel any hard spots or anything of that nature. Next, I'm going to move along to the uterus. So I would do a fundal check. I would measure from the symphysis pubis to the top of the uterus or the fundus and then see what that measures to be. I would also want to palpate and just see if that uterus is firm or boggy, and I would want it to be firm. I would not want it to be boggy, which would be soft and tender. I would want to see if it's midline or displaced to the left or right, and it should be midline. And then I would also measure the height in reference to the umbilicus. So after the uterus, I would move along to the bowel and to the bladder. So starting with the bowel, I'm going to go ahead and listen to the bowel sounds, and I should hear gurgles. So after listening to the bowel, I'm also going to ask a few questions, and I want to ask if they've passed any gas or if they've been able to have a bowel movement, and if so, that'd be great. Sometimes they have not been able to. And then when assessing the bladder, I'm also going to ask if they've been able to urinate, and sometimes they will not have been able to, but if so, I'm going to ask if that caused them pain or if there was any odor to that urine. So moving on to the L would be the lochia, which is discharge that women get after their postpartum, when they're in postpartum. So it's measured on an hour, and it's measured on the pad that they're wearing. So I would want to assess the pad, and I would want to look at that bleeding, see if there's any clots or any odor of that nature, and just want to see if there's any abnormalities of that. If the pad hadn't been changed in 2 hours, I would want to half the amount just to make sure that I'm grading it on 1 hour. And then moving along, I would want to look at the perineum, and if they had episiotomy, I would want to assess that. If they had natural tearing, I would also want to assess that. For our C-section moms, you're going to want to look at the back and look and see if they're having any hemorrhoids, or you also want to look at that epidural site. When looking at those lacerations, you want to measure that on a Rita scale, which is for redness, edema, ecchymosis, drainage, and approximation. So I would want to measure those lacerations on that. And then lastly, I'm going to want to look at their emotional status, and I would do that silently. And I would want to see if they're feeling tired, which would be normal, or if they're cheerful, cooperative. Also, another thing that you want to check for is their extremities. You want to make sure that you're not seeing any signs of a DVT. So I would want to check the pulses of the arms, radial, brachial. I would want to check those pulses. I would want to check cap refill, and just feel those extremities and look and see if there's any abnormalities that could be concerning. I would want to check the pulses in the feet, popliteal, and then the two pulses in the feet as well. Check cap refill of that, and just make sure that I'm not seeing any concerning signs that may indicate a DVT. So I believe that's it for the postpartum mom.